On VE Day, in this care home, they have reasons to celebrate as well as to commemorate. Unlike many other homes across the country, they have had no coronavirus deaths. They locked down early and it seems to have worked.
I mean, we're 7 weeks in, we're COVID-free. We're still not through the thick of it yet. It may still change, but so far so good. Our plans have worked.
And the families, though clearly struggling, are supportive of the strict rules that are keeping their loved ones safe.
I completely supported their decision to do it early because it is minimising the risk. I can deal with it if it means that my mum is safe, or as safe as she possibly can be, by adding an extra week or two onto the lockdown, then that's okay, because I know that they're doing that for the best interests of my mum.
But this is a rare success story in a sector that is under severe strain.
We're very sorry. Today's allocation of test kits have been issued. Check back here tomorrow when more will be available.
And yet this is the message that some care homes are getting on coronavirus testing. Shazad runs 3 homes in London, one of those in Sutton, where the death rate has been devastating.
That home, we have 63 residents, and in the last 2 months, 23 residents have very sadly passed away.
So far for this home, he has only been able to get the results of 10 tests, 9 of which were positive for COVID-19.
It feels like we're being sent from pillar to post in this process. You know, we'd contacted CQC, they've gone back and said, okay, no, it should actually be Public Health England. We've been given various phone numbers to contact. Again, called one this morning, which basically said that there's no tests available.
But in a different home just down the road in Cheam, it's been a very different experience because they were given enough tests early on.
Of the 36 residents that we had at the time, 29 were positive for COVID-19, and around half the staff were positive as well.
That's quite shocking, isn't it? Sorry to interrupt that number. I mean, you must have been quite shocked.
Yeah, we were extremely shocked. What it enabled us to do was to adjust our staffing levels.
Over that same period, 4 residents died. Did that level of testing save lives in that home?
Definitely. Had we had the testing done earlier, I honestly feel that we would have been able to save a lot more lives within our home.
When we put this to the Care Quality Commission, they told us the facilitation of testing is outside of their statutory functions. Public Health England referred us to the Department of Health and Social Care, and the Department of Health and Social Care said they would look into it. We also put it to the government. Why can they still not get the tests that they need?
Well, look, I think the reality is with the testing, we've now got around 90 different mobile test centres and another 50 or so drive-through right around the country. It's inevitable when you're trying to use up all of that capacity. We've got over 100,000 test capacity now. It's inevitable that there will, in some regions, perhaps not be sufficient numbers in some days, and there will be daily fluctuations.
An admission on a day marking the end of one war that the fight against coronavirus is far from won.
And Liz Bates is with you now. Liz, what did they say about PPE?
Yes, so last night on the programme, we revealed that millions of out-of-date PPE products were sent to frontline workers. When that was put to Public Health England, they said that those products had been tested and that they were safe, but that they wouldn't be releasing those test results. So we raised that at the Daily Downing Street press conference today. It was, as you just saw, George Eustice, the Secretary of State, but the person that answered was Stephen Powis, the National Medical Director for NHS England. I asked him why those test results won't be published. Channel 4 News revealed last night that millions of out-of-date PPE products were distributed to frontline workers. Public Health England say they were tested and that they were found to be safe, but that they won't release the results of those tests. So can you tell us now why those test results won't be released?
So my understanding, as the government and releases the PPE equipment and delivers it to hospitals and other settings, is that any items that have gone past their original date of expiry are retested to ensure that they still keep or are still at the right standards, and they would not be distributed unless they had been retested to to meet those standards.
And Liz, an extraordinary development today. Keir Starmer, the leader of the Labour Party, made it on the front page of the Daily Telegraph on VE Day. What's that all about?
Yeah, I have to say it was a sort of spitting your tea out moment to see on VE Day the front page of the Telegraph with a message from the Labour leader on it instead. Remember that this is a newspaper that is not only supportive of the Conservative Party, but has had the current Prime Minister, Boris Johnson, as a columnist. So on this day, to have the Labour leader on the front of it, really, really surprising. What's interesting about it, really, I think, is the politics of it. It shows that the Labour leadership has shifted. It's clearly happy to work with Tory newspapers now and to go after Tory voters. It will be interesting to see how Downing Street responds.
Indeed it will. Liz Bates, thanks very much indeed. Well, a little earlier, I spoke to Mark Roscoe. He's the Chair of Trustees for the Healthcare Supplies Association, the body representing the NHS buyers who've been desperately trying to source PPE supplies. And I asked him about out-of-date PPE that's been handed out to frontline workers. Now, we talked to some frontline medics who saw our film yesterday about the PPE kit, and they were so alarmed that they peeled some of the labels off some of the gear that they had and found other labels, earlier labels underneath those labels, and they were terrified by what they saw. Are they right to be terrified?
Well, I can understand the concerns of it, but that's because those products have actually been relabeled a couple of times. Now, ordinarily, you might think that's a bit strange, but they have been through various testing regimes to make sure that they were fit for purpose. And we were obviously at pains to make sure that that was the case before they were issued to frontline colleagues. And
these tests have been carried out. Have you seen the results of these tests?
Yes, we have. And in Wales, we've also, with our surgical material testing laboratory colleagues, carried out some tests of our own. So we have had the information shared from Public Health England with us.
Right. And why are these test results not being made public to reassure NHS frontline workers?
Well, I'm a bit surprised by that, to be honest, because I think it would have been more helpful. And certainly in Wales, when we pushed the product out, we did provide some additional comms and some additional information because we knew it would be a question that would come back. So I do find it a bit odd as to why they haven't released the information when they've got it.
It's really important, isn't it, to communicate directly with frontline workers and establish some degree of trust in the equipment that we're asking them to use every day.
Yeah, absolutely. And I think without that, it begs some questions and inevitably people feel that there's something to hide. And I don't believe that is the case because this product has gone out, it's been used successfully.
So to be clear, is there anything to hide?
Not as far as I'm aware. And certainly if we felt there was a problem, we wouldn't have issued it to frontline staff.
I mean, I don't know if you saw the story that we did last night, but the fact is that we had low stocks of respirators, for instance, and more than half of them were out of date. I mean, this, on the brink of a pandemic that people kind of knew from January was heading our way, it's just unacceptable, isn't it?
Well, it does beg some questions, certainly, but there were a review had been undertaken following the last pandemic, and the process of moving to just-in-case, just-in-time contracts put in place. And the intention of that was to be able to bring product into the country in significant volumes to address the requirements. Now, those arrangements were put in place. Those contracts did exist. Unfortunately, because of various other reasons, some of that product hasn't flown. And the volumes of it probably wouldn't have been enough to meet what has subsequently emerged as a major challenge across a whole range of PPE.
Mark Roscoe speaking to me earlier. Well, Scotland is staying in lockdown, so is Wales, with a few modest adjustments. While in Westminster, ministers said the public should expect only limited changes on Sunday night when the Prime Minister prepares to set out his roadmap towards easing lockdown restrictions in stages. The 4 UK nations might appear to be moving at different speeds, but all of them are warning that if things begin to get out of control, they won't hesitate to reimpose bans. Here's Minnie Stevenson.
A bank holiday weekend, but not as we know it. Usually a rambler's paradise, the parks, though, now more empty. Some still enjoying the sun. While the spirit of spring may be in the air, lockdown continues, as it became clear that the speed at which it's eased could vary between the different UK nations. Wales have already extended by 3 weeks with minor changes, and in Scotland, First Minister Nicola Sturgeon confirmed restrictions would roll on.
Yesterday, I, with the First Ministers of Wales and Northern Ireland, spoke to the Prime Minister, and I reiterated then that Scotland's lockdown restrictions would stay in place for now.
But Boris Johnson is expected to announce a slight easing of the lockdown in England on Sunday, albeit very limited. This is what lockdown looks like in East London's Broadway Market, where Hackney Council have deployed their own team of so-called social distancing advisors for crowd control. Brilliant. Garfield usually is a door attendant in pubs and clubs, until now.
A few months ago, you know, social distancing, policing was sort of an alien concept, wasn't it?
It's weird. It's really weird. Do you know what I mean? But it's got to be done, isn't it? Do you know what I mean? It's kind of dangerous out here, so yeah.
And do you think some people think they're sort of immune to it and this doesn't affect them and they can continue their lives as they used to?
Definitely, yeah. Just unsociable things like drinking in the park and things like that in groups and all that. Do you know what I mean? We just break them up and tell them to go home. Yeah, do you know what I mean? If they don't want to go home, then we call the police.
Quarantine, lockdown, social distancing. Now, these are all words which have become part of our vocabulary. But at the beginning of a sunny bank holiday weekend, will people start to slowly slip back into their old routine or continue to be strict with themselves and follow the rules?
Some people just don't seem to get it, that this is really serious. And particularly as an elderly black man, and you would have heard the statistics yesterday, which tells me that I'm 4 times more likely to die because of it. I take it very seriously.
And do you feel there's been mixed messages from the government about lockdown, or do you feel pretty clear on it?
Definitely, it's not clear. It's not clear. And now it's even less clear because they sort of giving us hope and yet saying it's not going to be that easy.
Obviously I want it to end. I want to kind of get back to work. I want to see my family. I want to see my friends. But I understand why it's important, and I think if we need to stay in it for a little bit longer, that's fine.
While we might not yet know when and how we'll leave lockdown in a world where nothing is certain, some reassuring words by the side of the road.